Hi guys, welcome back to my channel. For those of you that are new, my name is Jasmine and today I will be doing a video on sickle cell disease or sickle cell anemia in honor of World Sickle Cell Day, which is June 19th. So in honor of and in the spirit of World Sickle Cell Day, I will be doing this video talking about the basics of sickle cell anemia. So I've already done a video on my experience and basically my sickle cell story. So I just kind of, in this video, wanted to go back to basics and really discuss what sickle cell is, how you can get it, and maybe stuff like that. Sickle cell disease is a disorder that causes the red blood cells to become misshapen or to break down, meaning that the sickle cells are in the shape of a sickle or a crescent moon. I will try to insert a picture of a sickle cell compared to a normal red blood cell. These sickle cells are shaped like this, like a crescent moon, and will cling to each other and cause blockages. Those blockages are what causes sickle cell pain and other symptoms to arise. For example, you can get a stroke, you can get pain crisis, you can get damages in certain areas of the body, so for example hips. You can get problems anywhere because of those little cells are getting stuck in your veins and causing problems. You can get problems in your vision. So many problems can arise from these misshapen cells. So that is as I think simple as I can put it. So now I'm going to move into some of these symptoms, and some of the symptoms that these sickle cells can cause are fatigue, pain. Pain is a major one. You can also get some infections from the sickle cell disease. So sickle cell causes a lot of pain because of these blockages. You can get pain anywhere in your body because obviously we have blood flowing from head to toe. Anything on your body can hurt at any given time. Sickle cell is a very tricky disease because it's not like you can plan when you're going to get pain or when your symptoms are going to be onset. So something that us sickle cell patients can do is kind of track the weather. If it's too hot or if it's too cold, the weather has a big disadvantage to sickle cell patients. If it's too hot, you should increase your intake of water because you can get very easily dehydrated. On the other hand, even if it's cold, you should still drink a lot of water, but if it's cold, you should try to bundle yourself up, stay in a nice warm room, heater maybe, but you don't want to be in a place where it's too hot again. If you do turn on your heater, it may cause maybe dehydration and other problems. Make sure that you are aware of what type of weather can affect your pains or sickle cell. That's a little bit of what the symptoms are. So depending on each person's blood levels, you may be required to take a blood transfusion. So that is one of the treatments that sickle cell patients can get, is a blood transfusion. And unfortunately, a blood transfusion is kind of like a little band-aid. It'll help you feel better. You get some sort of energy and you may feel better for a temporary amount of time. It's, like I mentioned, a bandage. It's not going to erase sickle cell anemia. It's not going to cure sickle cell anemia, but it will help you manage your pain and any of the symptoms that you are having. Also, another treatment that is very important in sickle cell patients is pain management. So for those pain crises that sickle cell patients get. They need pain medication. There are so many pain medications that are out there. The few that I have taken are, when I was younger, I was given Tylenol with codeine, and I now take, they give me morphine. The next thing that can help sickle cell patients are the pill hydroxyurea. So I wanted to describe hydroxyurea as best as I can. And so basically the way it works is that it increases the fetal hemoglobin production in sickle cell patients, and it slightly raises the total hemoglobin concentration in the body. The fetal hemoglobin reduces the chance that red blood cells will sickle in a person who has sickle cell disease. So the increase of that fetal hemoglobin will help combat the sickling process of a sickle cell patient. The hydrea or hydroxyurea is used in very severe cases of sickle cell, and it is used to reduce the complications that sickle cell patients have, such as the pain crisis, acute chest syndrome, and the severe anemia. Unfortunately, this medicine does not work for everyone, and besides this, there's no other really known treatment that I know of that can cure sickle cell. They can get a bone marrow transplant, and most have been pretty successful with that, but not a lot of people go through with that because it is a very dangerous procedure. So that's basically the basics of sickle cell disease, and so I just wanted to make this video just to kind of give a little quick detailed or a quick little background on exactly what is sickle cell, because it is a very complex disease and I'm trying to simplify it as best as I can. I just kind of wanted for people to know kind of what is sickle cell and what are the symptoms, or what are some of the treatments that are available to these patients. I just also wanted to mention that it is estimated that sickle cell disease affects about 90,000 to 100,000 Americans, and that 1 out of every 500 births of African American births are sickle cell births, and that 1 out of 36,000 Hispanic births is a sickle cell disease birth. So anyways guys, I hope you have an amazing World Sickle Cell Day, and let's bring as much awareness as we can all bring to this disease. We all deserve to live a happy and healthy life, and I hope all of you warriors who do have sickle cell disease continue to strive to be healthy. Thank you so much for watching. Please go watch my sickle cell story if you are interested in learning more about my experience with sickle cell. And also, please check out my Facebook and Instagram page. I will leave them linked down below. As always, have an amazing day, and I'll see you in my next video. Bye guys.